neurologist. I brought a neurologist to the conference, and this is Dr. Roya Vakili, and I'm delighted we're presenting together, and we're going to show you for the first time some cutting research, some cutting information, so enjoy. Big title, postural orthostatic tachycardia syndrome, called POTS. And we're going to do a novel treatment, and we have our young lady in the front who had the treatment, and she's going to say a few words with her mum at the end. So, first of all, I'm from Canada, as many of you know, and I have a small population, about 20 individuals with CHARGE syndrome, and one of them gave me a call one day, actually before COVID, after a conference. I've been interested in POTS for about 10 years, I've been thinking about it, and often with questions coming from you guys, so thank you. And this mum had a 17-year-old young lady with CHARGE syndrome who I'd known since she was a baby, and she said, Dr. Blake, she said, something's happening here. She's getting very, very, very fatigued on these hot days. I'm a pediatrician, I did a history. Her heart rate goes up, often really high. She gets very agitated, a lot of discomfort in the stomach, and then she seems to lose her colour, she could vomit, she gets sweaty, but she says, the reason I'm phoning you is she ended up in the emergency. And I said, oh, that doesn't sound good. I said, it's really interesting. Does she have that colour change in her legs and feet? She said, yes, she did. I said, I think she's got POTS. I have a feeling her mum may have said, I think she's got POTS. We both decided she may have got POTS. So we brought her into our hospital trying to recreate the symptoms. So we did what's called a tilt table test. Now the good thing about it, you don't need to have one of these to make a diagnosis. You need the symptoms and you need a sort of lying standing, which I'll go over in a minute. But we decided to do this, this tilt table test. We strapped young Charlie in, and here she is strapped, her mum and dad are behind there, and they're actually in the audience if you wanted to have a little chat with them afterwards. And can you wave? Hooray, great, and thank you for being here. And so we strapped her in, nothing happened. So we laid her down, we stood her up, we laid her down and stood her up. And then I think it was her mum that said, it's really tight over a bed. And I think Charlie even said, it's uncomfortable. Dr. Blake, Charlie doesn't like me sometimes, but anyway, it's uncomfortable. So we loosened it off, and when we loosened it off, wow, what did we get? We laid her down, we stood her up, and her heart rate went from 76 to 120, more than 40 beats, and the cutoff was around 30 for POTS. She had all these symptoms, and then she had this positive tilt table test. So by standing her up, but not only that, her legs changed colour. Her legs went sort of purple and white and mottly, and it's quite interesting because I've just had a very nice family from Germany that knows me that says they think this is happening in their 11-year-old son as well. That was just before the conference. So, I'm going to tell you what POTS is. It stands for postural, the position in your body, orthostatic, standing upright, tachycardia, very fast heart rate. So it's in the title. It's under an umbrella called dysautonomia, and we've always thought that there was dysregulation in CHARGE syndrome. Think about all of you coming out with the pain and temperature regulation, and all of this is the internal regulation that happens without us thinking about it. So regulating the heart, regulating the gut, regulating the movement of blood. So it's a part of the dysautonomias. Why does POTS happen? The physiology. It's characterized by this rapid heart rate on standing. So if you think about it, you stand up and you get what's called vasodilatation. Your blood, all of us, our blood goes to our legs, and our autonomic system moves that blood very fast up into the head to stop us feeling like this. And of course, most of what we felt with CHARGE, it's balance, and that's why they go all wobbly, but it's that particular, and it's actually triggered by things as well. So you get that vasodilation, that blueness of the legs, or whiteness of the legs, and what we call brain fog. So we did a study, and this was actually before COVID. It will be published before the year is out, I promise you. Look out for it on the website, and I'll come to that later. It was called, we used a validated questionnaire called the Compass. There is a better one out now, but we changed it a little bit to fit charge syndrome, because a lot of the little bits of things in that validated study really wouldn't do well for you guys to answer. Anyway, we changed it slightly, and then we looked very much at particular symptoms: tachycardia, presyncope, fatigue, nausea, constipation. It had some other things in there as well. So we had 25 participants, some from that original conference, some from home where I am. We tried to keep it so it wasn't all people that said, yes, I think I've got POTS. So we tried to get a broad spectrum, but of course people are going to come to us to want to hear about POTS and be part of the study. So what we found is there were particular things that were very frequent: the tachycardia, the headache, the fatigue, which is now in the literature called brain fog, but real fatigue, like being wiped out, and constipation. And the triggers I'll come to in a minute. We could split our population into two groups: one that had loads of these symptoms, daily, weekly, that would literally knock you out, and that was 10, and 15 that had very few. So given that, we really had about 40% of our participants. POTS in the regular population around 1 or 2%. So this is high. Now, we also did some qualitative data. So we asked our group, our population, what it was like. This is one young lady's report from her mother. It's awful. We have to go to hospital regularly for fluids to help her come out of these episodes. She can't walk, talk, eat, drink. She feels like she's falling down, and she misses school, and she sleeps and sleeps and sleeps. So that was very, very, in her words, what happened regularly. Now, everybody, like charge, is a spectrum. Not everybody's like that, but there is a spectrum of these symptoms. So as I said, we had themes, and we had about 40% of individuals in that small study. So I'm saying to you, and I said to myself when I said POTS is more frequently found in individuals with charge syndrome. We think it is. More studies need to be done. You could do a 10-minute stand test. Now the interesting thing is, doing it, the things that trigger POTS are things like poor sleep, like you probably know how you feel when you've had a couple of bad nights of sleep. Poor sleep. Temperature, it seems there's a huge amount of temperature regulation problems here. So when it's very high temperatures, especially going from somewhere like this to outside, people can't regulate very well. So that's a trigger to it. So sleep being a trigger, that being a trigger. So knowing your triggers and knowing how to treat it is very important. So brain fog, fainting, palpitations, fatigue, those are those big ones. But interestingly, there's all these abdominal ones: vomiting, nausea, diarrhea, bloating. I know that many of your kiddos, many of the individuals with charge have all of those things. Is it POTS? Now, I'm not saying everything is POTS, but a lot is the vagal nerve, and you've all heard me talk a lot about the vagal nerve. So that's, I'm going into that older research, which we know the vagal nerve's affected. This is the treatment, which is very sort of behavioural and little things you can do. And I like the blue man on the left-hand side that you can see. You're sitting, you're standing, and all that blood just doesn't come up. It comes up when your vagus nerve is working well, when you haven't got dysautonomia, but when you've got, where that system is not regulated, you can imagine it's happening worse with all those triggers. So small meals, increase fluids, but the fluids need to have salt in them. Caffeine, well, I like my Diet Coke, people like their coffee. I mean, that's I think you could, but being careful how much. And avoiding prolonged standing. But I'm going to add to that, I'm going to add conditioning exercising as well. Very important. So your body is becoming conditioned. Think about your muscles and your legs, and you're trying to condition. Sometimes a belly band helps, sometimes stockings help, but they can be quite restricted, and they may not be comfortable. So those are some of the how to treat generally. Then you've got the pharmacological. I draw your attention to fludrocortisone. That's the safest. Don't have to really monitor it too much, maybe some electrolytes, but some of the others I worry about because of all the other charge issues. But a good neurologist, a good cardiologist can sort of say, yeah, we could try that, we could try that. But the fludrocortisone, I think, is a good, it's sort of, to me, that goes with some of the behavior. It's not too aggressive, and it just helps retain salt and water. And so my summary is that POTS is difficult to diagnose in a syndrome where you've got so much happening. You may have read a lot about POTS in post-COVID, long COVID now. You may have seen some stuff about very similar symptoms in Ehlers-Danlos, hypermobility syndromes. So Roya's going to bring a lot of that to light now. We feel there's a big overlap. And I was very, very, very delighted that our family down here, that's Laurie and Lacey, were able to find a neurologist. So I hand you over to Roya now.
Hello everyone, I'm Dr. Roya Healy. I'm a neurologist in New Hampshire at Dartmouth Health. I've been in practice for more than 15 years. I have my subspecialty is epilepsy, and that's how this lovely Lacey came to me, and we went through this journey of finding out that she has POTS syndrome in addition to her epilepsy. So not all her symptoms were due to seizures. She actually doesn't have seizures very frequently. She has seizures a few times a year, but she was having all these episodes of feeling pale, headaches, discomfort, passing out. And what happened was actually Lacey and her family attended Dr. Blake's lectures. And by talking to her, they realized that she likely has POTS. And then they came to me and we talked about getting history again, which is very important in medicine. And she gave me the history of course she has POTS syndrome in addition to epilepsy. And it's very much underdiagnosed in charged population because they have so many symptoms, and we're going to get into that. So that's the introduction to my talk. What happened? And by talking to Dr. Blake, the family talking to Dr. Blake, they figured out that maybe vagal nerve stimulation can help her symptoms. And we know vagal nerve stimulator helps the parasympathetic system, which now we're going to the science. Patients with POTS, there's a combination of sympathetic and parasympathetic nervous system, which is called the autonomic nervous system. And the parasympathetic system doesn't work very well, and it's the hyperdrive of the sympathetic. What the vagal nerve does, it helps the parasympathetic nervous system. It helps basically calm down the heart rate. It helps blood pressure to be regulated. It basically, it's the nervous system that gives us relaxation for our gut to relax, to digest, and to function. So this vagal nerve is a very important nerve that controls the system. And the thought is, by stimulating this nerve, can we control POTS symptoms? And there's been a lot of research on this. This is not something new. There's actually, there's the Ehlers-Danlos group. They're doing research on this to help vagal nerves. By stimulating the vagus nerve, it helps the POTS symptoms. But the fact is, the vagal nerve stimulator is actually FDA approved for epilepsy, because we know the vagus nerve not only is involved in controlling the parasympathetic nervous system, controlling the gut, it also sends a stimulation to the brain that stops seizures. And it has been FDA approved for control of epilepsy and seizures for many years. Since 1997, it's officially approved. Insurance covers it for patients over age 12 to control seizures. And later on, they found, even kiddos over age 4 years old would benefit from it. And the safety profile was very good, and the effectiveness to control seizures was very high. So in 2017, it's basically 4 years and above, because it's such a safe procedure and safe mechanism to control seizures, that they got FDA approved. So this vagus nerve, I want to show you the device, is basically a battery that you can see under the skin. It's a minor surgery. They implant it and they put the wires to go up to the vagus nerve. And this is how the device looks if you want to look at it this way. So we have the battery generator under the skin. It's minor surgery. They do a very superficial cut, and then they have the wires that goes further up to the neck, and it goes around the vagus nerve. And then the doctor has this wand, and it has this laptop to control the stimulation for the vagus nerve. You can control it. Usually the standard protocol is every 5 minutes. You can send an electrical stimuli to stimulate that vagus nerve to control seizures. And the interesting thing is by doing that, it also helps with parasympathetic nervous system to control gut health. It controls POTS symptoms. So it has many benefits. Because this device is so effective, they found that it actually got FDA approval for another indication. It helps with depression because it sends signal to the brain. It basically, for patients age 18 and above, it got FDA approved to treat refractory depression. These are patients who don't respond to medication. From 2005 till now, it's been approved. So as I said before, there's a lot of research on this. That they're trying, there's research going on right now with EDS and POTS that it helps with that. With migraines, it actually got FDA approved in 2018. Another device, it's not this device, but another device that helps with migraines. However, it's very expensive, so it's not used so typically in migraine clinics. And there's research going on for inflammatory bowel disease, fibromyalgia, pain, because this is very effective. Okay, so now we're going to go to our case, just having the information about how this device, where it's located, how it functions, and what happened to our case, Lacey. So Lacey's here today. They're actually on the front row. Wave your hand. Okay, very good. So she's 25 years old. She has CHARGE syndrome, and she has a multitude of symptoms that go along with POTS, CHARGE syndrome. She also has POTS, and she also has epilepsy. And since this device is FDA approved for epilepsy, insurance would cover it, and we got the device implanted. What happened after we implanted this device? There was a significant improvement after 3 to 6 months of having the implant. The way the device works, let me give you a little bit of information. If the heart rate goes above a certain level, I can program a device to send a stimulation to the vagus nerve to calm down the nervous system and stop the heart rate going too high. So that's how it works. So the way we program the device is, the standard protocol is every 5 minutes it sends a stimuli electrical impulse to the vagus nerve to decrease the heart rate and stimulate the vagus nerve. So, but it also has another program that we can do an auto stim. That means if the heart rate goes 20% above a certain level, it will send an automatic impulse. So, in her case, every time her heart rate goes high, it sends a stimulation to the vagus nerve to decrease the heart rate and calm down her nervous system. So it's not in that flight and fright state. And what's interesting about this device that there's more benefit from it. Actually, it has helped her cognitive state. It has helped her alertness. And we think it's more than just controlling the seizures, because we know patients who get the vagus nerve stimulator, the number of seizures decrease about 50% in this patient. And she normally gets a few seizures a year. So we think the reason she's so alert and she is so engaging is because of controlling the POTS symptoms. So a couple other things, she was able to say a few words. She normally doesn't communicate verbally. She was able to stand on her feet, take a few steps, and normally she's wheelchair bound. So some other interesting bits that I downloaded from the vagal nerve stimulator device. So you can download information about each month how her heart rate is going, which is really cool. It records her heart rate in a 24-hour duration. And so, for example, this month, which was May of this year, she came to Disney. She went on a roller coaster, and they kept a journal of all her activities. The days that she went on the roller coaster on the rides, her heart rate was more elevated. So you can see that peak over there. So we know the way the device works is when her heart rate peaks, it sends an extra stimulation again to the vagus nerve, which is located in the neck, and it decreases the heart rate and controls those fright and flight symptoms. So she was able to tolerate the roller coaster and complete the roller coaster. She didn't pass out going on the roller coaster, so that's how the device helped in that situation. Here's another history. In November, she went swimming, and obviously they had the journal of all her activities. The day she went swimming, which was on November 12th and 11th, is when her heart rate again peaked when we downloaded from that device. And okay, she's smiling, she's able to tolerate being in the swimming pool, she didn't pass out, she didn't get pale, she didn't get tired, she was able to stay there the whole duration. So this is how the device is making a change in her life. I have more examples, but I just picked a few. Here's another one in the summer of last year. She had another elevated heart rate on June 10th. And again, she was able to, and that's when she went horseback riding, we saw in her journal, and she didn't fall off the horse, she didn't pass out, she didn't get pale. So she was able to do a lot of activities that she wants to do in her life. So that's what was amazing. So this is another thing that the device records and generates each month, and I document it and I review it. So with this device, it shows how often it's a normal stimulation of the vagus nerve that we program. So, and then there's the auto stimulation when the heart rate goes above 20% of our baseline. And then there's a magnet. With this VNS device, there's a magnet that you can use if patients having symptoms or if they're having seizures. You can swipe over the device to send an extra stimulation to the vagus nerve. What was really interesting was the normal stimulation is about 8%, but the auto stim was about 5%. For most of my epilepsy patients who have seizures this infrequently, the auto stim would be 1%, but in her case, it was as much as it going off every 5 minutes to control the sensitive stimulation, basically, because that 8% is meaning that every 5 minutes there's stimulation to the vagus nerve. So that means that her POTS was so active that her heart rate was going so high that this device had to work extra hard to control her symptoms. And that's why she was able to function so well. So this was kind of an interesting finding compared to other epilepsy patients who have as many seizures as she has. So just a take-home message, about this vagus nerve stimulator, it is a device that can help many conditions. It's not just indicated for epilepsy, but however, for it to treat POTS and other conditions, it's still in research phase. It has been FDA approved for epilepsy, it's been FDA approved for migraines, it's been FDA approved for depression, but perhaps for POTS. And we're not the only group who is excited about this device for POTS. There's Ehlers-Danlos group who is actually conducting, and I think an FDA run a trial at this point, but maybe this could be something for the Charge syndrome patient population. So, but we want to save a lot of time for questions, and we also want Lacey's family to come and talk a little bit. So please come. It's been a pleasure working with them. It's been hard. We did the implant in April of last year, and it's been over a year now that she's had this vagus nerve stimulator.
Hi, I'm Lauren, and this is Lacey. I didn't realize how much POTS affected, because she most likely had it for a long time because she was having lots of issues. But since she had this, she's just more alert. She even said some words, and it's just amazing. Like when we go to Disney a lot, so of course we go on the roller coasters and the rides, and lots of times in the heat, she would be sleepy and not feeling good. But this last May when we went, I couldn't believe she was so happy, smiling, and so I know that the stimulator did a difference because she was eating food. I mean, she's G-tube fed. She has a J-tube, and so she was eating food. I had puree squash, and she ate my whole puree squash. She kept on. She's nonverbal, but she was touching my hand for more. And then we went to Peaches and Cream, and she ate my tomato soup. She kept on for more, and her constipation is better. Her gut, because she's had lots of problems with her gut, lots of pain and migraines and stuff like that.
It's really been amazing. So we want your questions for us here, the three of us. So go for it. You're going to pass the mic around, and we've got a mic up here as well.
GI is definitely a very key point.
Hello. I've already chatted with Dr. Blake quite a bit over this weekend, but so my daughter has tons of these symptoms and was actually diagnosed with POTS because we participated in Dr. Blake's study, and that kind of stemmed us to see stuff with some specialists. But my daughter's only 14, so she would meet the criteria for the depression and those kind of symptoms for an implant. What are the odds that age limitation of 18 may change and go younger for that FDA approval?
I'm going to give you two on neurologists who can talk to that. So what about age limits and who is it approved for?
Absolutely. Right now for depression, it's over age 18, unfortunately. And we're actually thinking if we catch this early and we treat the patients earlier, they're going to do better cognitively. So I think you definitely have a point to wait that long to get this. And that's why we're trying to set up maybe a study, a clinical trial to show that this is highly effective and patients do well. But we need more patients, and we need, the problem is if we can get an NIH grant or if we can get another grant to be able to run the study. And there's spectrum of patients with Charge syndrome. There are patients who have it very severe and patients who have it less severe. So I think it would help all of those patients. I mean, the vagus nerve is so involved in so many things, from the brain function all the way down to the gut. We call it the wandering nerve, right? It's the longest cranial nerve that's involved in flight and fright, calming down the nervous system, stopping the flight and fright when these patients have such an extreme reaction and to just standing up and heat and so forth. So it will make a huge difference in their life.
So from a clinician's point, I'm a basic pediatrician, I'm a basic, sort of clinician. I would say just you having the knowledge of this, and we're going to post this on our website. We've got permission from all of us around here. We need you to take this information to your doctors and to be aware. So even before a vagal implant, which sounds like it, how much it's helped Lacey is amazing, and I think this is the future. But the future has to be a trial, and if we can do the same thing that Ehlers-Danlos is doing at the moment, because there's a lot of lap over with gut symptoms. So all of those hypermobility, the mobility syndromes. So if we can do that, I was chatting to a research group yesterday, they're interested. I just need more people, and if there's anybody who's great at grant writing or can pull this together, and I've got my little PEI group that are interested as well, that we're going to make this happen. But your knowledge about this, going through a checklist of symptoms, looking to see the diagnosis, and doing some of those sensible, easy things. And I'm conditioning exercising being very important as well. So those things are really good. I don't know whether Lacey's doing any of those exercises, is that?
Yeah, that's what they told me. So we're doing like things where she can sit and with a bike, and I'm trying to get her an exercise bike for in the house so she can do that. We do swimming. We have my son got a Make-A-Wish, so we have an outdoor swimming pool. We have it heated, and so I have a walk around when, not of course in the winter, but I have a walk in the pool and then try to swim and stuff like that.
And she's only really been able to do this because she was so affected. You could hear from Roya's presentation how much that is firing off to help her actually be able to do her activities. So I'm sure there's more questions, so carry on.
Just quickly, so is our best course of action to talk to our local specialists and push it locally, or are there things we can participate in with you guys to help, or both?
Both. I think both, but I think first of all, you've got a diagnosis. We chatted about it a bit more. Doing some of the sensible things. Fludrocortisone is very beneficial, and working with working with the behaviors, the drugs, and then keep looking to see whether we can push for approval. Whether there's going to be approval. Somebody's going to do it.
Hi, this is Jocelyn, who's 17, next to me. She does have quite a lot of the symptoms that you have mentioned. happened, it was after she'd had physiotherapy, when they'd had her standing, they put her back in her wheelchair to wheel her back downstairs to her classroom. She'd become unresponsive, they couldn't wake her up, she was clammy, and I don't know if you can see, but her legs were like that, very mottled.
Very bottled, yes.
She has other symptoms as well, like you've been talking about. So what I wanted to ask is the first one, Jocelyn has got a cardiac pacemaker for low heart rate, which has recently been inserted. What that does, it kicks in if her heart rate goes below 40, which isn't often when it happens. So I wanted to ask if you can have a VNS with a cardiac pacemaker, and also in the UK, which specialty of doctor is it that I would need to speak to about this?
I'm going to give that to our neurologist. So the question is, just to repeat it, is who's the specialist that Jocelyn and her mum would go to, and can she have this as well as having the pacer?
Very good question. If she already has a pacemaker and she has very low heart rate, generally we do not recommend the vagal nerve stimulator. We would do combination of specialists to see, obviously, with the POTS. Cardiologists are key members of the team. Normally, most of my patients who have charge or EDS have cardiology, neurology involved. For vagal nerve stimulator, usually we like for patients who don't have too many cardiac conditions, just because it lowers the heart rate. And in her case, usually we give it for patients who have very high heart rate, tachycardia, as the POTS syndrome indicates. But there are variations of dysautonomia. There are patients who have very low heart rate and they require a pacemaker. So unfortunately, this patient wouldn't be a candidate.
Is there other treatment or medication?
The fludrocortisone, absolutely.
Yeah, so I think the fludrocortisone is your first stop. All those behavioural things, the fludrocortisone, as Laurie was saying, those conditioning exercises to try, because those do help. And then things like the belly band and stockings.
Stockings.
She's got stockings.
Yeah.
Yes.
No, but she didn't tolerate the belly band.
She didn't like the belly band. Yes, the little guy in Germany works very well with his belly band, and that makes a huge difference. And the stockings, as Lacey's got stockings as well. So all of those behavioural things, because it's very important to try those and keep all of those things going while you're looking at the big treatments, which will be the VNS implant. But I think those drugs that I put there, it sounds like your daughter's got a cardiologist, of course, and so, working with them, being knowledgeable, taking this presentation with you, it's available. We are going to make a POTS handout. We've got a lovely one on abdominal migraine, come and pick it up at the poster session, but we are going to make one for POTS as well, so that we could be good for you guys, and it will be on my website, which I keep telling people about. But it's lovely because it's a foldable. Took us ages to work out how to fold it, but anyway, that's my brain. But it's a foldable version. You can print off in colour and fold it yourself. So look out for that. That'll be done by Christmas. Okay.
Hello. My son is now 30, and he's been presenting like weird symptoms. Like last November, we had to take him into the ER, and he was totally dehydrated. His electrolytes were very low, and we've been keeping them up with Pedialyte. I mean, he's been having these weird sweats. He doesn't communicate where the pain is, and he's been crying for pain, which is totally unusual on him. We ended up finding out he had gallbladder stones. He had his gallbladder removed last week, but yesterday he was crying again the same, and he's kind of sweats. I mean, he always wears long pants, and we really cannot see his legs when he's taking a shower, so we haven't been able to see the changes in the color. But yes, the changes in temperature, so he has a different temperature in his head, different temperature in his body, and it's been really weird, and nobody has been able to figure out what it is and how to keep these electrolytes up. So it's sounding a lot. His constipation is getting way worse than ever. I mean, he's always had constipation, but this is terribly bad, so.
So I'm going to ask our neurologist, because it would be her checklist that she uses to diagnose POTS clinically, and I do a similar one.
Okay. Based on the symptoms you're saying, it sounds like POTS is definitely a possibility. We generally do more workup to see, if a patient has POTS. It may be a good idea to see a cardiologist locally. Where do you come from? Which state do you come
Miami.
from? Miami. Okay, very good. So I would bring those symptoms to your doctor's attention and say, I've been to a conference. Patients with charge often have POTS, and it's been underdiagnosed. So some of the testing they can do in the office, they could do an orthostatic blood pressure check, lay him down, sit, and stand, and see if he has intolerance of orthostatic. One thing, you could treat on your own, hydrate him. Sometimes, if the blood pressure is very low, we add more salt, we add more electrolytes to see if that could improve his symptoms. If he keeps on improving with those interventions, that's more likely the patient has POTS. Elevating the legs will help. Leg exercises is another thing that can help with circulation. A lot of times if you're sitting for a prolonged period of time or standing for a prolonged period of time, it causes pooling of the blood in the legs. So you can use compression stockings. You could use abdominal binders to help prevent the pooling of the blood in the stomach or in the legs. And if he improves, that's indication that this could very well be POTS. But I think a lot of doctors overlook this diagnosis because charge patients have so many things going on with them, and they don't go the next step to see, oh, it's going to be POTS. We could treat it with non-pharmacological therapy, or we could intervene with medication. Usually we don't go with medication as the first treatment because a lot of times with change in exercise regimen, with fluids, compression stockings, patients improve significantly, up to 50% or more. So I think, based on the symptoms, this could very well likely be POTS, but it would be best to have his doctor involved.
Yeah, it's also been hard to find as an adult. Like I just found an endocrinologist who's willing to really get involved with him, but I haven't been able to find a neurologist,
Yes.
that would wanna be able to invest.
I can
I'm
ask
just
that.
going to ask Laurie a minute how she found her doctor.
It was through Lacey's PCP, Dr. Plotnick, who happened to specialize, her specialty is children and adults with special needs. So she's a pediatrician and an internist. And so I was able to and she started a family complex care. So I was able to get connected with her. And so she sees me and the whole family, and she's a doctor, her PCP and mine. And so we had a neurologist at Boston Children's, but we needed to, he was retiring and she's aged out. So she sends all her patients to Dr. Vakili, and she recommended Dr. Vakili, and that's how that started.
And I was going to say something about what kind of a neurologist would be a good neurologist for POTS. It would be basically neuromuscular specialist or POTS specialist. Currently I'm in Dartmouth Health, but before joining Dartmouth Health, I was at Cleveland Clinic, and they actually had a POTS clinic. And there were doctors who specialized in POTS. So if you even call neurology office and say, I do want to see someone who specializes in POTS, they have specific doctors who treat POTS. So usually they're dysautonomia clinic or neuromuscular specialists.
There are a lot of doctors also that don't actually believe in POTS as well, generally, especially cardiologists. So finding the right person, doing a checklist by yourself. There's lots of checklists online for POTS now. Because of COVID, it's actually become it's just boomed. The long COVID has happened, and many of that population have symptoms of POTS. So there's lots of checklists. So doing the checklist, watching for the triggers, keeping a diary. You guys keep amazing diaries. So keeping a diary, keeping notes of those things, perhaps doing the, I mean, it's very easy to do a heart rate sort of sitting in a recumbent position and then standing, especially when there's triggers around, like the heat and stress. If you've got some of that, and you take it, like if a patient brings me that information, it's wonderful, because I've got a diary, I've got the symptoms, I've got a checklist, and I've got Dr. Blake's presentation, and you know what, and it really helps. Thank you.
Thank you.